Our next section is spine disorders. Now, those spine disorders will include anterior spinal artery infarction and subacute combined degeneration of the cord from B12 deficiency, spinal trauma, spinal shock, Brown-Séquard syndrome, which is a classic from the War of 1812, getting bayoneted in the back, and syringomyelia. Fortunately, anterior spinal artery infarction is uncommon. We lose all function of the cord except the posterior column because the anterior spinal artery will supply everything in terms of motor and sensory sense except for what controls position and vibratory sensation, which remains intact. There's going to be flaccid paralysis below the level of the infarction because all the motor pathways have been cut. There's going to be a loss of deep tendon reflexes precisely at the level of the infarction. But below the level of the infarction, there will be evolution into spastic paraplegia several weeks later, which means that there will also be hyperreflexia below the level of the infarction. You get loss of pain and temperature because it's controlled by the decussation in the center of the cord, which has now been killed by the infarction. And you have an extensor plantar response because it's like cord compression or transverse myelitis. The whole cord has been cut above, so there's an exaggerated reflex of the extensor plantars. Now, you notice we're not using the term positive or negative Babinski because that's not precise. It is more precise to say there's an extensor plantar response. Unfortunately, the therapy for anterior spinal artery infarction is there is no specific therapy. And this issue of everything is lost except the posterior column is the most frequently tested question for this disorder on step 2. Subacute combined degeneration of the cord, generally speaking, from B12 or neurosyphilis. I'd like to point out folate deficiency may cause the same hematologic manifestation as B12, but folate deficiency is distinguished by having no neurological abnormalities in an adult from its deficiency. You lose only position and vibratory sense. Everything remains intact except position and vibratory sense. So in that sense, with everything else intact, this is exactly the opposite of anterior spinal artery infarction. In the anterior spinal artery infarction, everything is lost except position and vibratory. In subacute combined degeneration of the cord, everything is kept intact except position and vibratory sensation. Spinal trauma, particularly from motor vehicle accidents, results in acute limb weakness and sensory disturbance. It's exclusively below the level, just at and below the level of that injury, and its severity is in proportion to the degree of injury. Really meaning that if your degree of injury is extremely severe, you're essentially become paralyzed. And that's because the spinal canal is very narrow. You get banged in the back, it swells, the swelling compresses your cord, and you are paralyzed. Not just paralyzed, sphincter function is impaired, and you are having urinary and fecal problems, loss of deep tendon reflexes at the level of the injury, and hyperreflexia is followed by hyperreflexia below the level of the trauma. The best initial therapy is treat it with glucocorticoids. Remember, you get banged in the spine, it swells. There's no room. You use steroids to decrease the pressure, just like cord compression from cancer. The Brown-Séquard syndrome is a making carpaccio out of your spine. It's a unilateral hemisection of the cord. It's due to injury exclusively. It's a rare disorder. Nevertheless, it doesn't matter if it's rare if it shows up on step 2, a knife or a bayonet cutting your cord in half from behind. And on physical exam, you will find, well, on one side, you're going to lose position and vibratory sense and motor, but you lose the contralateral pain and temperature. And although there's no treatment, the most frequent question is simply, what's the most likely diagnosis? And the diagnosis is based on the fact that pain and temperature cross as soon as they go into the cord and go up on the other side. So if I cut the left cord, I'm losing the right pain and temperature. If I cut the left cord, I'm losing the right pain and temperature. But if I cut the left cord, I lose the left-sided position and vibratory sense. Syringomyelia is a fluid-filled dilated central canal of the spinal cord. It's a widening dilated central canal. You can call it a bubble or cavitation. The neural fibers in the center of the spine get ripped, they get broken. Well, we don't go to medical school to just say a bubble in my cord. We say a syrinx in my myelia. Now, part of the difficulty here is myelia is the word that we use both for the white matter of the cord and white matter inside of bone marrow, so it can be confusing. Myelodysplasia is preleukemic in the bone marrow, but myelitis is an inflammation of the spinal cord. Syringomyelia is a bubble, cavity, or syrinx, and syrinx is an ancient Greek word for cavity in the center of your cord. It's caused by a tumor or severe trauma to the spine. How do I answer the question, what's the most likely diagnosis? I'm going to look for loss of pain and temperature bilaterally. I'm going to look for it across the upper back in both arms. I'm going to look for this phrase that's called cape-like distribution, as if I'm wearing a cape across your back, across your shoulders, neck, and arms. And there's loss of reflexes at that level. Muscle atrophy occurs because if we cut all those neural innervation cells, you're simply going to have no neural innervation. The muscles die away without stimulation. Now, this is a very unique presentation. You should have no trouble at all because there just isn't anything that does bilateral pain and temperature just across the back of the arms. You might say, well, how come it's across the back of the arms? How come it's not lower in the legs? And the answer is very simple. It is the upper thoracic cord is simply more vulnerable to injury. There is a bigger space, it's more vulnerable, and because the trauma simply occurs there more often, the lower spine, although there may be a lot of low back pain, simply doesn't cause that type of injury down the lower spine. A bubble or syrinx in the lower cord is simply not as common. Which of the following is the most accurate test for syringomyelia? Which of the following is the most accurate test for a person with loss of pain and temperature bilaterally across the upper arms? The answer is MRI. Well, it's not really that hard a point. You could actually say anything in the spine is MRI. Multiple sclerosis, most accurate for almost anything. Transverse myelitis, MRI, it's most accurate. Yes, and the best treatment is, well, if it happens from trauma and cancer, it is time to do surgical treatment to remove that cancer. Surgical treatment for removal of the tumor. Surgical treatment to drain the cavity that happens. Bang! I formed a bubble. Let's drain it.